Bedwetting is the loss of bladder control during the night. The medical term for bedwetting is nocturnal, nighttime enuresis. Bedwetting can be an uncomfortable issue, but in many cases it's perfectly normal. Bedwetting is a standard developmental stage for some children. However, it can be a symptom of underlying illness or disease in adults. About 2% of adults experience bedwetting, which can be attributed to a variety of causes and may require treatment. What causes bedwetting? One causes of bedwetting: physical and psychological conditions can lead to some people having bedwetting. Common causes of children and adults having bedwetting include a small bladder. Your child's bladder may not be developed enough to hold urine produced during the night. Inability to recognize a full bladder. If the nerves that control the bladder are slow to mature, a full bladder may not wake your child, especially if your child is a deep sleeper. A hormone imbalance. During childhood, some kids don't produce enough antidiuretic hormone, ADH, to slow nighttime urine production. Urinary tract infection. This infection can make it difficult for your child to control urination. Signs and symptoms may include bedwetting, daytime accidents, frequent urination, red or pink urine, and pain during urination. Sleep apnea. Sometimes bedwetting is a sign of obstructive sleep apnea, a condition in which the child's breathing is interrupted during sleep, often due to inflamed or enlarged tonsils or adenoids. Other signs and symptoms may include snoring and daytime drowsiness. Diabetes. For a child who's usually dry at night, bedwetting may be the first sign of diabetes. Other signs and symptoms may include passing large amounts of urine at once, increased thirst, fatigue and weight loss in spite of a good appetite. Chronic constipation. The same muscles are used to control urine and stool elimination. When constipation is long-term, these muscles can become dysfunctional and contribute to bedwetting at night. A structural problem in the urinary tract or nervous system. Rarely, bedwetting is related to a defect in the child's neurological system or urinary system. Hormonal imbalances can also cause some people to experience bedwetting. Everyone's body makes antidiuretic hormone, ADH. ADH tells your body to slow down the production of urine overnight. The lower volume of urine helps a normal bladder hold urine overnight. People whose bodies don't make sufficient levels of ADH may experience nocturnal enuresis because their bladders can't hold higher volumes of urine. Diabetes is another disorder that can cause bedwetting. If you have diabetes, your body doesn't process glucose, or sugar, properly and may produce larger amounts of urine. The increase in urine production can cause children and adults who normally stay dry overnight to wet the bed. 2 risk factors for bedwetting: gender and genetics are among the main risk factors for developing bedwetting in childhood. Both boys and girls may experience episodes of nocturnal enuresis during early childhood, usually between ages 3 and 5. But boys are more likely to continue to wet the bed as they get older. Family history plays a role, too. A child is more likely to wet the bed if a parent, sibling, or other family member has had the same issue. The chances are 70% if both parents had bedwetting as children. Bedwetting is also more common among children diagnosed with attention deficit hyperactivity disorder, ADHD. Researchers don't yet fully understand the relationship between bedwetting and ADHD. 3 lifestyle changes to manage bedwetting. Certain way of life changes may help end bedwetting. For grown-ups, setting limits on liquid admission has a huge impact in controlling bedwetting. Make an effort not to drink water or different fluids inside a couple of long periods of sleep time to decrease the danger of having a mishap. Drink most of your day-by-day liquid necessities before dinner time, yet don't restrict your general admission of fluids. This will guarantee that your bladder is generally unfilled before sleep time. For kids, restricting liquids before sleep time has not been appeared to dependably diminish bedwetting. Attempt to likewise remove energized or mixed beverages at night. Caffeine and liquor are bladder aggravations and diuretics. They'll make you pee more. Utilizing the washroom just before you hit the sack to purge your bladder completely before rest can help too. For children, a stressful event in a young person's life can sometimes cause bedwetting. Conflict at home or school may cause your child to have nightly accidents. Other examples of situations that can be stressful to children and may trigger bedwetting incidents include the birth of a sibling, moving to a new home, another change in routine. Talk to your child about how they're feeling. Understanding and compassion can help your child feel better about their situation, which can put an end to bedwetting in many cases. But a child who develops bedwetting but has already been dry at night for over 6 months could signal a medical problem, too. Talk to your child's doctor about any new bedwetting that does not resolve itself within a week or so, or is accompanied by other symptoms. Refrain from punishing your child for bedwetting incidents. It's important to have open and honest conversations with them about bedwetting. Reassuring them that it'll stop eventually can be helpful. Also, allowing and encouraging your child to take as much responsibility as is appropriate for their age is good too. For example, keep a dry towel to put down and a change of pajamas and underwear by the bed for them to change into if they wake up wet. Working together helps create a nurturing and supportive environment for your child. While having bedwetting can be normal in younger children, talk to your pediatrician if your child is over the age of 5 years old and still has bedwetting a few times per week. The condition may stop on its own by the time your child reaches puberty. 5 complications. Although frustrating, bedwetting without a physical cause doesn't pose any health risks. However, bedwetting can create some issues for your child, including guilt and embarrassment, which can lead to low self-esteem, loss of opportunities for social activities, such as sleepovers and camp rashes on the child's bottom and genital area, especially if your child sleeps in wet underwear. 6. Medical treatment for bedwetting. Bedwetting that stems from a medical condition requires treatment beyond just lifestyle adjustments. Medications can treat a variety of conditions of which bedwetting is a symptom. For example, antibiotics can eliminate UTIs. Anticholinergic drugs can calm an irritated bladder. Desmopressin acetate increases levels of ADH to slow nighttime urine production. Medications that block dihydrotestosterone (DHT) can reduce swelling of the prostate gland. It's also important to control chronic conditions, such as diabetes and sleep apnea. Bedwetting associated with underlying medical issues will likely resolve with proper management. 7. Takeaway. Most children start out growing bedwetting after 6 years old. By this age, bladder control is stronger and more fully developed. Lifestyle changes, medical treatment, and support from family and friends can help children and adults overcome bedwetting. While bedwetting can be overcome with lifestyle modifications, you should still see a doctor to rule out any possible underlying medical causes. Also, see your doctor if you've never had bedwetting but have recently developed it as an older adult. 8. When to see a doctor. Most children outgrow bedwetting on their own, but some need a little help. In other cases, bedwetting may be a sign of an underlying condition that needs medical attention. Consult your child's doctor. If your child still wets the bed after age 7, your child starts to wet the bed after a few months of being dry at night. Bedwetting is accompanied by painful urination, unusual thirst, pink or red urine, hard stools, or snoring.